Hello and welcome to another History Online free tutorial. And in this one, we're going to be looking at medieval Renaissance public health for the health in Britain topic. So thank you for joining this session. And in this session, as I said, we're going to be looking at medieval Renaissance public health for the health in Britain topic. And we're going to be looking at the comparison question for the AQA exam, comparing public health between the medieval time and Renaissance time. Firstly, though, over to a quick quiz to see how much you can remember about medieval and Renaissance public health. Right, well, here is the quiz. 8 questions on medieval and Renaissance public health. Now, if you need to revise this, look down at the QR code at the bottom there, give it a scan, and it'll take you to our Quizlet notes on this, and you can revise those notes, give the quiz a go, do some good active revision, testing your knowledge as you go. So have a look at these questions. You can pause it and then have a work out of the answers, and then I'm going to go through them and explain them shortly. So here we are then. The answers. So we're going to be looking at, firstly, who was the famous mayor of London who built privies or toilets along the banks of the River Thames to improve public health. And it's not just a pantomime character, it is a real person. Dick Whittington built those. So a really easy one to remember. Building privies to improve the public health of the town. Obviously, it did make the river stink a little bit, but it put waste out of the streets. So it was a proactive move in many ways. Where in medieval England might you find sewers and clean water supplies? Of course, a monastery. So we're thinking about factors here, the factor of religion helping to improve public health for people. What about the Black Death and public health? Well, question 3, who ordered streets of London to be cleaned to get rid of the miasma smell? Well, King Edward III. So a really good example of government and government trying to improve public health in this time. So name the major disease that took place in London in 1665. Of course, the Great Plague, moving into Renaissance time, the Great Plague, and there's lots of things going on to improve public health there, as you'll see in the other questions. So what was the nighttime job? We went around emptying the cesspit. So if you had a toilet, you'd have a pit underneath it. So underneath the privy would be a cesspit, and a gong farmer would go around emptying those cesspits. So during the Great Plague of London, people who had the disease had a cross marked on their door, and no one was allowed to enter. What Q word summed up what happened to this person? Well, they were quarantined, and obviously, quarantine comes from the French word 40, so they'd be locked up for 40 days. And then, obviously, if they're still alive after that time, then obviously the disease had gone. Okay, so much more proactive government action about public health with clear laws. Another clear law. Question 7, how did some people help to stop the spread of the Great Plague? They looked for ill people. So women searchers were sent around looking for ill people to see who had the disease. And what was the name of the person who would stand guard outside a contaminated house during the Great Plague? A watchman. Okay, and they would make sure the person did not leave their house and would make sure that the diseased person would stay in there. And then obviously after 40 days, they could come out if they were still alive. Right. So how do you get on? Hopefully you've got some good knowledge and you've revived well, because we're going to move on to our skills now. Right, so here is our question we're going to be looking at. Explain 2 ways that public health in the times of Black Death and public health in times of Great Plague London were similar. So we're obviously doing the breadth topic here, which is a study over time. So one of the skills AQA would like you to do is be able to compare 2 time periods. So you're going to get a question in your AQA exam that starts off with explain 2 ways, and it's going to be asking you about similarities. So you can prepare for this question. You can prepare comparing all the people, all the different time periods, about surgery, public health, and treatment. You can plan an answer and pretty much be prepared for anything that comes up. So here is one I'm going to go through with you. I strongly recommend you go through all the key people, all the key times, comparing public health, treatments, and surgery. This one, as I said, is about public health, which is the ways in which we try to keep society healthy. And normally it's about government keeping society healthy. Sometimes in the medieval time, it's about religion, but mostly it's government. So what would you need to do to complete this answer correctly? Have a read over the question, take a pause and think about what you need to do to complete this question and get 8 marks. So here's my ideas. So obviously you need to explain It says explain. It's the first word in the question. So we're looking for our P and our PL paragraphs. Well structured, focusing on the question. We are looking for focusing on a topic, which is public health in this case, and the two time periods, Black Death time and the Great Plague time. That does not mean specifically the Black Death or specifically the Great Plague, although they're going to be a big focus of yours. It does say the time of, so you can sort of focus around that time period. You need to give clear points on why they are similar. And it's an explain question. So you need to explain why they are similar, not just how they are similar. Give an example, and this is where you do for your how bit, describing the similarities for each time period. Both time periods should be mentioned. Then you've got to explain why they're similar. What factors maybe of the time period are driving the similarities? Why are they still the same? Link to a wider similarity, if you like. What else is that factor doing? Or is there another factor causing it? Can you explain a bit more? I recommend you have a little bit of a table in the exam. You know, you sort of brainstorm your ideas, or more fashion terms, you talk about brain dumping our ideas down about public health during the Black Death time, public health during the time of the Great Plague. Make a list of ideas, maybe only two or three ideas, and then see what similarities you can see. They won't be necessarily the same, but they might be the same factor causing them, might be the same sort of general idea behind them. So do this yourself now. List some of the ideas of public health in the Black Death time, public health in the Great Plague time. We should not see any surgery or treatments here. It should be ways they're trying to prevent disease and theories behind disease and how they're trying to stop them. All right, so hopefully you've had a bit of a think, you paused, had a go. So here are some of my ideas. So public health at the time of Black Death. So we talked about in the quiz, Edward III told people to remove the bad smells of London by tidying up. Government started to bring in laws to clean towns. Market traders had to clean up afterwards. You know, one of the major things was saddlers or tanners who worked with leather, leaving urea, which is, you know, all around the place, pouring into rivers and things. Or market traders who are animal markets leaving animal guts and waste around. All of this was very bad. We've got obviously some of the mayors of London, like Dick Whittington, building public privies along the River Thames. Individuals were told to clean up their doorsteps. It was a law. Also, individuals might pay for gong farmers to empty their cesspits. During the Black Death, some cities like Norwich and Gloucester closed their city gates to stop the spread of the Black Death, to stop visitors coming in who might have the disease. So what about the Great Plague? People believed in stopping miasma to improve health. Plague doctors used their sweet-smelling flowers to purify the air. They would wear those long beak things with flower petals in them. They'd be all covered. Their whole skin would be covered. Everything be covered to stop bad air getting to them. The government banned trade between England and Scotland during the plague to stop its spread. People with the plague were quarantined for 40 days, and watchmen ensured they did not leave the house. The government banned wooden houses after the Great Fire of London because they were unsafe. And public health remained poor with cesspits, open sewers, and a lack of clean water still in this time. So you can have a look at those. What similarities are there? Can you see some similarities? What is there different, same ideas, same factors, same problems, same successes? What can you see? Have a look. Pause and have a think for a moment. So here's my ideas. So firstly, there is miasma, and people were cleaning up. Edward III had told people to clean up because of miasma, and the doctors, the Great Plague, were fearful of miasma and what they wore and what they did. The government brought in laws to control movement of people and to control waste. So in the medieval time, the government started to bring in laws to clean towns, and you've got a range of government laws in the Great Plague. We've got obviously quarantine laws, and you've got the government banning particular quality of housing. You've even got banning of trade between Scotland. Okay. And then you've got closing down movement of people, clearly at the bottom there. Norwich and Gloucester closed down people coming to their cities, and the government banned trade between England and Scotland to stop the spread of plague as well. So we've clearly got a change in the way in which people can move. So we've got a number of options to explain. So we need to explain using our Peel writing frame. So one way public health during Black Death was similar to public health during the Great Plague was give some evidence. During the Black Death, this happened. use the word similarly. It's such an easy word to use. Similarly, during the Great Plague, this happened. These are similar because. And then if you're going for 7 or 8 marks, you need to think about furthermore, wider people, wider place, wider time, a wider idea, a bigger, maybe a social change, a bigger change that's going on. Okay, so let's give this a go then. So I've got the opening sentence for you. So one way that public health during the Black Death was similar to public health during the Great Plague was that government was becoming far more involved. So we're going to go with the government idea being more involved. So look back, you can flick back to the little table if you like. Give this a go. See if you can write the answer. Fill in the evidence now. So just the evidence section. For example, during the Black Death, they did this. Similarly, during the Great Plague, they did this. So pause and give it a go. Okay, so here's my example. So, for example, during the Black Death, local government started to lock their city gates. You could then say, obviously, Gloucester and Norwich would be better to use that name, place names. Similarly, during the Great Plague, the government banned the movement of traders between Scotland and England in particular. And these are similar about public health because, okay, so give an idea, see if you can pause and think about an idea. How are these similar about public health? Why are these similar? What can we explain about why they're similar? Okay, about public health. So these are similar because in both times the government realised they could do more to stop the spread of disease by stopping people person-to-person contact between obviously the infected and uninfected areas. People strongly believed in person-to-person contact. We're starting to believe now in people carrying smells, perhaps, people carrying disease with them. And if they stopped the contact between infected and uninfected areas, they could stop the disease. So is there a wider idea we can think of? Furthermore, they are similar because wider people, wider place, wider time. We step a bit further into this. Have a think, see if you can come up with an idea to get those top band of marks. Right, so here's my idea. So furthermore, they are similar because in both times the people started to have more influence on the government. So the people who influenced the government. After Black Death, peasants became more wealthy, had more influence around the time of the plague. And at the time of the plague, the civil war had taken place and Parliament ruled the country. This meant public health improved as people would have demanded more healthy conditions to live in. So that peasants, you could take that peasants when the Black Death step further. You got the Peasants' Revolt of 1381, peasants challenging the king, those sorts of ideas. You could take that really a step further. And so this meant public health improved. People would have demanded more healthy conditions, yes, possibly, and fear of the government of those issues. So now over to you. Give a go of a second idea we had in our table earlier. Ideas of miasma, perhaps. You could maybe explain about how miasma was a similar theory in both times. Here we go, explaining a second paragraph. So hopefully you've now got some excellent comparison skills and you can compare across those time periods. You revise your knowledge really successfully. Do subscribe and there's more videos on the way. Bye-bye for now.